scientists have made tremendous progress in fighting cardiovascular diseases. Even so, well over 60 million Americans, that's more than 1 in 4, have some form of heart disease. It's been the leading cause of death in this country since the early 1900s. In this show, we're going to examine some of the latest advances in treating heart disease. We'll meet a nationally ranked swimmer and see how a rapid heart rate threatened to shorten her career. Next, you'll meet teacher Betsy Evans and hear from Rocket Center Akeem Olajuwon about a common type of irregular heartbeat. Then John Bevins, a young father who didn't know he had severe heart disease, will see his remarkable recovery. Finally, we'll meet the Reverend Edgar Smith and see how surgeons performed the newest kind of bypass on him. One of the most innovative fields in cardiology today is electrophysiology, the study of the heart's electrical system. When it's defective, it causes irregular heartbeats called arrhythmias. Now let's meet Grace Price. Grace Price is ranked in the top 13 in the United States in the 100-yard backstroke. She practices 5 hours a day, 6 days a week to swim for less than 58 seconds.
Everyone searches their whole life for that one thing that's their thing, that they do maybe better than anyone else or the best that they can do. And swimming is the one thing that I do. For me, it's my life, it's my soul, that whenever I swim, and I compete and I'm racing other people, it's like I'm letting my soul out for someone to take a little peek at. And it's not a big peek, but that's the closest they're going to get because they're looking right into me and they're not just looking at me, they're looking into me.
Grace's father, Ray, was a Navy SEAL, a former basketball player at the University of Houston, and a football player for the 49ers.
I miss my dad very much.
He died a year ago at age 56 of congestive heart failure.
The greatest lesson I learned from my dad was you practice like you play, that every time you get in the pool for practice, that's what you're going to do in the meet. So if you don't do it right that day, every single day, then you're not going to do it right when you compete.
Grace was 2 years old when she started swimming. Her mother was an Olympic qualifier in long-distance open water swimming.
My mom always told me, if you don't enjoy it, then just don't do it. I mean, what's the point?
From the time she was a child, Grace's heart would race, but no one took her seriously.
And everyone would just be saying, oh, you're just having an anxiety attack, you're under a lot of stress, or you're just a hypochondriac, there's nothing really wrong with you, you're too young to have any kind of heart problems.
4 years ago, Grace's heart started racing during her workouts.
When I'd be swimming and I would start having the trouble with my heart, I would just be in the middle of a set. I'd feel sort of a tingling sensation and pressure, and my heart would start getting faster and faster. I would turn white, really, really pale, and my lips would turn purple, and then I would start getting sick.
She has what's called a supraventricular tachycardia, a tachycardia that comes from the upper chambers of the heart. And this was due to a short circuit in her heart, a true short circuit. She was born with an extra wire, and this extra wire became active actually about 5 years ago.
Your heart is a strong muscular pump. 2 upper chambers called the atria and 2 lower chambers called the ventricles pump blood into the lungs and body. Your heart's electrical system caused the 4 chambers to beat in an organized manner. This process is triggered in the upper chamber by an electrical signal that then triggers the lower chambers to contract. In Grace's case, she grew an extra electrical pathway connecting her upper and lower chambers. This caused her heart to beat abnormally fast. Dr. Pacifico will insert a catheter to the extra pathway. Using radiofrequency energy that produces heat, he'll melt it away. Grace's heart returns to its normal beat.
For surgery, we had nothing. Some of this young individual would basically be very limited. They couldn't do what they wanted to do. In Sydney, they couldn't do competitive sport, just like this young lady. You know, she is a competitive swimmer. She's very good, I understand. And hopefully she can return to win the gold medal.
Dr. Antonio Pacifico is an electrician of the heart. He's board certified in internal medicine, cardiology, and electrophysiology.
Doing okay, Grace?
Throughout the radio frequency ablation, Grace will be awake and alert.
So Gracie, everything's going fine so far?
I'm excited. I'm nervous, but I'm excited.
Now he places sheaths into a large vein in her groin. Over the sheaths, he'll place catheters that'll go all the way to Grace's heart.
These catheters have two functions. I can record electrical stimuli from the heart, and I can also deliver extra stimuli so I can start actually the supraventricular tachycardia. Once you find out exactly where the extra wire is, then I can ablate it.
The catheters are used to search for the precise location of the extra pathway that's causing Grace's arrhythmia.
We are now putting the catheter and moving these catheters up to the heart. Now I need to concentrate, so unless you have something urgent, let's don't talk. This is the most difficult part of the procedure, okay?
The catheters are used to search for the precise location of the extra pathway that's causing Grace's arrhythmia. The monitors in the electrophysiology lab are recording 14 different places in Grace's heart. He sends electrical stimuli through the catheters to raise her heart rate to around 250 beats per minute.
There are multiple channels, there are hundreds of little squiggles that have to be interpreted. For us, it's just like reading Chinese in a fast-moving band. And so what you do, you're just reading continuously the signals and see if you can pick up which one is the extra signal and where this extra wire is. These extra wires are not big, they're microscopic, they're less than a hair. So you explore the heart in a way that you can identify where this extra signal is coming. It's just like reading a book and finding what the misspelling of the word is. We can raise the temperature of the body and the thing melts away. The trick is to be right on it and be sure that it's correctly identified.
Dr. Pacifico must recreate her supraventricular tachycardia.
52, 55 degrees, 26 watts.
What was interesting about it was I was able to see my heart on the screen, that I was awake for the whole thing, and I was able to watch, and he was telling me everything that he was doing. And then all of a sudden he goes, well, 30 watts, 20 watts, 50 watts. And then all of a sudden I felt this heating in my chest. It started in one little spot and then it just spread like bad traffic or something. It just spread everywhere. And I was just wanting to take my arms out at the table and start cooling myself off. And that was whenever he was pacing and he was heating away the extra pathway.
Okay, pace in Angel 300. Lights on, please. Good. Off. 350. Lights on. Tracy, we found the extra wire and I think you're all fixed up. We're just going to wait 10 minutes. If he does not come back, we're going home, okay? That's it.
I was a lot more scared than I needed to be, but it wasn't that bad. He's a really good doctor.
Grace has returned to her classes at the University of Houston and is enjoying life.
Since the surgery, I feel great. I've been healthier than I've ever been. You know, the color in my skin tone has changed, like the color in my skin, better circulation. I've been eating better. Everything has just changed.
We've gone from a disease that only 15 years ago could have impaired a lifestyle for the rest of her life to making not only normal, but hopefully super normal.
Everything has just changed. All of a sudden, I don't have to worry about going into a tachycardia again or anything. It's just a whole new beginning.
Atrial fibrillation is the most common heart rhythm disorder. One of the most well-known people to bring the condition to the public's attention is the two-time NBA champion, Akeem Olajuwon. 1 in 10,000 healthy young adults like Akeem have this arrhythmia, and it has no clear-cut cause. Akeem was in the locker room at halftime when he experienced atrial fibrillation. He had just taken a drink of cold water.
And I couldn't really swallow. I felt like something in my chest. You know, since then I knew that something is not right. You know, I didn't feel comfortable. But it wasn't painful, but it was uncomfortable, annoying, uncomfortable, where you feel like you're trying to swallow something, but it's right there.
Akeem has educated himself about arrhythmia. Each morning he takes the medication Lanoxin to control it.
I was talking to the doctor the other day that maybe I should stop taking it. I don't like, I don't want to stay on this medication because I feel fine. But I say, well, I may be off season right now. Let's stay here. Off season. Maybe we'll see what happens because it's unpredictable.
It's an intermittent phenomenon. An intermittent phenomenon can only be caught when you're present. But we have tools today that we can actually give to the patient. They can carry with them a small little watch, even a watch that can record the rhythm when they push the button.
Atrial fibrillation is usually intermittent in young adults like Akeem, but in 25% of cases it can become chronic, like in Rockets fan Betsy Evans.
And I'm sitting by our penny collection for a good reason. Today, we've got a job to do, to figure out how many more pennies we have to get so we will have our 1,000,000 pennies.
Betsy Evans has a talent for solving problems. Last year, she was one of 4 finalists named Teacher of the Year by the Alief School District.
I just love math. I love to make the kids have to think, and kids love math. And if they don't love it when they come to me, they don't leave me till they do, believe me.
2 years ago, Betsy was faced with a problem she couldn't handle on her own.
But I'll tell you, you don't know right now that your heart is beating. And I don't know that my heart is beating right now, but when you go into atrial fibrillation, just like Akeem Olajuwon, you know that you feel pretty uncomfortable and it's pretty scary because you know you depend pretty much on your heart to keep you going.
Over 20 years ago, Betsy set out to live the American dream. She married. Later, she and her husband had 2 sons. She expected her family would always be together.
About 10 years ago, my husband left me. I'm a real family person, and to see my children hurt and to be hurt myself, I think was just a little more stress than I could handle. And I soon noticed that my heart was not beating as it should beat. And so went to a cardiologist and found that I had atrial fibrillation. I guess the scariest part of going into atrial fib and knowing that the medicine wasn't taking care of it, the scariest part was the threat of a stroke.
About 75,000 strokes occur each year in people with atrial fibrillation. Because the upper chambers of the heart are not pumping, blood clots can form in them and travel to the brain and cause a stroke.
And the first thing they did was put me on Lanoxin, and it, took care of me pretty much at that time. And then found that I still would lapse back into atrial fib again. And I went over a period of about 8 years, I was up to taking 3 different kinds of heart medicine.
In the last 2 years, Betsy was spending $250 a month on 3 different heart medications. She still felt tired and lethargic all the time.
One of the problems with some of the medications that she was using was the fact that they have side effects, and one of the side effects is depression. The second thing is she could not do much because the heart rate was so uncontrollable. Anytime she was moving around, she might be running about 150, 180, 200, and she was feeling tired all the time. So she was having atrial fibrillation.
Normally, when your heart beats, it fires electrical impulses from the upper chamber to the lower chamber. In atrial fibrillation, the upper chambers of the heart fire hundreds of electrical impulses in an erratic manner, causing it to quiver instead of contracting. The lower chamber can't receive these erratic signals, and it beats abnormally fast. Dr. Pacifico dislodged the electrical system in Betsy's lower chamber and inserted a pacemaker to restore her normal rhythm.
She was beating on her own, but she was going a little bit too slow. She was not pacemaker dependent, but we gave her a pacemaker so she could support herself when she needed it. So she wanted to run, she wanted to jog. The pacemaker would increase the heart rate instead of keeping the heart rate in the 40 or 50s like she would be without the pacemaker.
I feel like he's just saved my life. I told him the other day, I said, to see in the paper that I have the best doctor in the city, and he said, no, I'm not the best. And I said, you think they'd get second best for Akeem Olajuwon? And let me tell you what I've been doing at my age. I never tell my age because I'm a lady, we don't tell, do we? I go to Southwest Sports Medicine and I work out. I do about 45 minutes on the treadmill and about 45 minutes of weights. I have started taking country western dance lessons. I'm now at the 4th level of country western dance. You never realize how much you appreciate your health until you've almost lost it. And then when you come back and you really start feeling good again, you think, wow, got to use this.
Almost 500,000 bypass operations are done each year. the majority are performed on men under the age of 50. Now let's meet John Bevins, a young father who didn't know he had severe heart disease, and see his dramatic rescue by a stranger.
And right when I got about here, I really got dizzy, like I was going to pass out.
It was 8 o'clock in Memorial Park. John's life was about to change.
I couldn't shake the uneasiness and the lightheadedness, so I laid down.
What amazed me was that there were all these people on the track running by, not stopping for you, all these cars in front of me that were just tapping on their brake. And as I passed you, it was very obvious to me that you were trying to get someone's attention.
It was Diane Price who stopped and took John to his car. He called his wife from her car phone. Diane left John at his car, went to the tennis center, and called 911.
On the way there, we passed an ambulance, and I thought, oh God, please don't let there be an ambulance. Don't let that be going to Johnny.
Johnny was experiencing what we describe or call angina, which is pain in the chest associated with a decreased blood flow to the heart muscle. That is, of course, unusual for a 40-year-old man performing relatively mild physical exertion. So I elected to admit him to the hospital under the care of a cardiologist for fuller evaluation.
He had an uncle that died at a very early age of coronary artery disease. He has also smoked for many years, has been found to have high blood pressure. His cholesterol was known to be elevated, and he's been sedentary. Those in conjunction with his presenting history made us very worried about what he might have.
Although his baseline electrocardiogram was essentially normal, I advised him for further investigation with a stress thallium the next day.
You're going to go a little bit faster now.
This is a non-invasive way of screening for coronary artery disease. First, John exercised. At its peak, a nuclear agent was injected into his vein. A nuclear image was then taken of his heart, comparing the resting phase with the stress phase.
He revealed that not only one, but more than one areas of the heart muscle was at risk for